Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. Today we continue our conversations about the COVID-19 pandemic. We all know someone who would have tested positive, and unfortunately, too many of us know someone who would have passed away from COVID-19. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. I'm wearing my mask as usual, covering both the nose and mouth, but I'll take it off so we could continue this conversation. COVID-19 is real, and it has touched us in a very devastating way. Not just Guyana, but also our neighbors. And we continue to see the effects of COVID-19 as we go about our daily lives. Too many persons would have died, over 370 persons in Guyana already, and over 425 persons in Trinidad and Tobago. This is frightening, this is devastating, and we continue to have large numbers of persons testing positive. And this is something that concerns us all. This is something that is all our business. And we have to continue to take measures and put systems in place so that we minimize exposure. Continue to wear your mask. Avoid crowds, stay at home as much as possible, sanitize, maintain social distancing, wash your hands as much as possible. And when you get the opportunity, please get vaccinated. I can't stress this enough. We need to get as many persons in the country vaccinated as possible. It is our best chance of getting back to any level of normalcy anytime soon. We need to have immunity against COVID-19. That is the ability to fight off the disease if you should be exposed to the virus. There's two ways in which you can develop immunity. One is to get the disease and recover, and the second way is to get the immunity from vaccination. Now, if you get the disease and hope to recover, the majority of people will recover. Unfortunately, between 2 to 3% of persons will not recover and will die. And even those who have recovered, there are long-term effects from the disease that are quite devastating. Some effects you can feel, some effects you can see, and some you can't. The effects on your mental health, for example, is quite severe. People can have sleepless nights, mood swings, depression, anxiety. All of these things can occur in recovered COVID-19 patients. Worse in those who would have been in hospital and make it out of hospital. So to actually get the disease is a bad way of getting the immunity when you recover. The easier way is to get the vaccine. You may get some vaccine side effects that last for less than 24 or 48 hours, like some fever, pain at the injection site. Some people may have some fatigue and tiredness. But it is a much easier way to get immunity by getting vaccination than actually getting the disease and hoping for recovery. So there's a lot of questions, a lot of concerns that people have about these vaccines. And a lot of these questions and concerns are being fueled by misinformation in social media and other platforms. And it's important for us to continue to shed light and continue to educate people on the facts regarding vaccines. So the first question or the first concern that people have generally is regarding safety of the vaccine. So these are a couple of the things that you need to know about COVID-19 vaccines. People think that vaccine safety is in question because the vaccines were developed so quickly. Well, the fast tracking of vaccine development was not accidental. It was actually due to advanced technology that we have now that we didn't have in the 1950s and the 1960s and 70s. We actually have better technology and the ability to do rapid gene sequencing, etc., in order to identify viruses and to create vaccines to them. We actually had research already existing on coronaviruses. We know how coronaviruses act because we've been exposed to coronaviruses before in the form of the Mediterranean or the Middle Eastern respiratory syndrome, as well as the SARS. So we know coronaviruses from some time now, at least about 10 years. So we already had a significant body of research existing before the appearance of COVID-19. The other reason why we were able to develop these vaccines so quickly is because there was a concerted global effort that was focused purely on the development of vaccines for COVID-19. It wasn't just one company or one country. There have been several companies, several countries engaged in the vaccine research and development at the same time. The other reason that people are concerned about vaccine is because of side effects. And we see all kinds of things on the news and in social media, etc. The big thing that people are concerned about or that caught our attention is the presence of blood clots associated with some vaccines. Yes, there is a rare condition associated with the use of AstraZeneca vaccine and Johnson & Johnson vaccine. The risk of blood clot, however, is less than 1 in 1 million. Less than 1 in 1 million. The more common side effects that we should be focused on are things like pain and soreness at the injection site. I had this myself when I got my first vaccine dose. It was much, much less after the second dose. There was some fatigue that some people have, sometimes headache, and sometimes you may develop chills or a little fever. Usually, in the vast majority of these cases, the side effects disappear within a 48-hour period. The COVID-19 vaccines have been proven effective in reducing the risk of becoming infected with COVID-19, and it has been associated as well with reducing risk of transmission from the vaccinated person to anyone else. There is also the biggest benefit associated with COVID-19 vaccination, and that is all of the vaccines, all of them across the board, have been shown to be highly effective, 100% effective in preventing severe COVID. And I would always like to emphasize, when we talk about severe COVID, we are talking about admission to ICU, being put on a ventilator, and even dying. There are common questions that people continue to have about vaccines. Big one, do the vaccines really work? The answer is yes. All COVID-19 vaccines currently available, not just in the US, but across the world, are highly effective at preventing COVID-19 severe infections. All of them. This is the AstraZeneca that we started out with in Guyana, the Sinopharm from China, as well as the Sputnik vaccine that we have here in Guyana. Are the vaccines safe? The answer is yes. Vaccines are safe. While more COVID-19 vaccines are being developed, routine processes and procedures remain in place to ensure that these vaccines are safe. We would not be recommending and giving out vaccines that have been shown to be unsafe to people. Are there side effects? Of course. Every medication, every vaccine that you take have potential side effects. The potential side effects for these particular vaccines include soreness and swelling at the injection site. I had no swelling. In fact, the majority of people that I know who had these vaccines did not have any swelling, but of course you had an injection, so there is some pain and soreness at the site. There are some people who would have developed fever and chills. I developed chills, but not so much the fever. People can have fatigue and headache, but these usually go away in about a day or two. If they don't, simple Panadol, paracetamol, Tylenol, the same thing, can work to relieve these symptoms. The other big question that people tend to have is, do I need to get vaccinated if I've already had the COVID-19 infection? And that's an important one. As we see, 16,000 plus persons would have had COVID-19 infection in Guyana. That's a question that probably 16,000 people would have. And the answer is yes. There are several health risks associated with COVID-19, and reinfection with COVID-19 is possible, although it is rare. But especially in the time where we're concerned about new variants, etc., and we know Guyana may be at risk for the Brazilian variant due to our geographic proximity to Brazil, this is something that we have to consider when we are planning out whether or not we should take vaccines. So yes, persons who would have been infected with COVID-19 before and recover, you are still recommended to have full dose of your COVID-19 vaccine. Now, initially we recommended that you shouldn't get this vaccine within 3 months of having tested positive for COVID-19. But that is mainly a recommendation based on vaccine availability. You can actually take your vaccine earlier than the 3 months, even though it still remains a standard recommendation. We have had several persons who took their vaccines before that 3 months, and they have all been quite safe, and these persons are doing okay. There are several reasons why you should get your vaccines. And the number one reason is really people who have gotten full vaccination can anticipate that they will soon be able to start doing stuff that they had to stop. Because, wearing of masks is one of the major concerns that people have had throughout this pandemic. And more people get vaccinated, many countries have started allowing public gathering without masks if you can demonstrate that you actually had both doses of your vaccine. And that is an encouraging development and something that we look forward to. We look forward to the day when we can go outdoors again, socialize with our friends and our family, and not have to wear masks. Vaccine is probably the best bet we have of being able to do so again. The next reason for getting vaccine is while no vaccine is 100% effective, all of the COVID-19 vaccines currently available have been shown to be highly effective at preventing severe COVID. Again, all vaccines that we have, not just in the United States, but in Guyana, all of them have been shown to be 100% effective in preventing severe COVID. Getting COVID-19 vaccine also offers protection from getting severely ill. When you get vaccinated, it can help protect others around you. So if you are in contact with persons who have severe underlying conditions like diabetes, heart disease, cancer survivors, etc., you being vaccinated could actually protect those people around you, because your chances of transmitting COVID-19 from the vaccinated person to someone else is also reduced. The combination of getting vaccine and following the basic recommended guidelines of social distancing, wearing masks, as well as sanitization is actually the best combination out there that is available to protect us from getting COVID-19 and from passing it on or getting severely ill from COVID-19. So again, I'm hoping that this would encourage more of us to get vaccinated. And if you have any questions or comments regarding COVID-19, the vaccine, etc., please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me.